Good afternoon, everyone. Good morning to some of you joining us from the West Coast, but I want to thank you all so much for joining us for today's webinar presentation, Taking Data Out of Silos. Of course, this is a part of our Cultivating Data-Centered Organizations Learning Community Group. My name is Hyacinth McKinley. I am the Program Associate here on the Learning Communities Resource Center at the Partnership, and I'm going to be helping to facilitate today's webinar event. As we do with all of our events, we like to do so by reciting the promise of community action together. We do this because despite our geographic separations, our different titles, the different projects that we work on, what brings us together in the work of community action is this promise. And it states that community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So here is the agenda on our screen, and as you all are taking a few moments to review that, I wanted to dive into some technical, kind of behind-the-scenes details for today's webinar. Please note that today's webinar presentation will be recorded, and this recording link, in addition to a copy of the slide deck, will be shared with you all in a couple of different ways. We usually share a follow-up email within 2 business days of any of our webinar events, and we also post them on the partnership website. Please note that unless you are a presenter, you will be muted for this presentation, but you should be able to hear us either out of your computer speakers or through the phone if you've called in. If you're connecting to the audio through your computer and you're having issues and you need to reset your audio, you can do that by going to the Communicate tab in the upper left corner of your screen and select Audio Broadcast to reboot your audio. Conversely, if you're connecting in through the phone with us today and you're having issues, please hang up and dial back in using the information provided either on your Quick Start tab or the Event Info tab. And if you continue to have any other technical or audio-related issues, please send those in to us through the Q&A box, and we'll do our best to help you get sorted out. We are very much encouraging for this to be an interactive presentation, so if at any point you have questions, comments, or concerns for our presenter, please send them in, and you can do so utilizing the chat box. And when you do, please be sure to select all panelists from the drop-down menu. That way we can all see it and make sure to answer your question. So we're going to keep going and dive right in. So a little bit about the learning community. The purpose of our project is to analyze community action outcomes and identify promising and innovative practice models that alleviate the causes and conditions of poverty. So a much shorter way of saying that, we like to say that the purpose of our project is to help you all build your capacity so that you can fight poverty more effectively in your community. And of course, this is of critical importance because it ties into some of our overarching community action goals as related to our theory of change, which you can see here on the screen. And a little bit more about the learning community specifically and some of the topic areas that we focus on. You can see them here on the screen. As I mentioned earlier, today's presentation is a part of our Cultivating Data-Centered Organizations Learning Community Group. But you can also see that we have some other open LCGs which meet during these dates at these times on our webinar Wednesdays as the continuation of our national webinar series. But you see some of our other groups. In addition to those, we also have our intensive learning community groups and our community of practice. And I will highlight that for those groups, they actually feature knowledge-building webinar presentations that are a part of the National Webinar Series, so you too can join in on the conversations, learning, and resources that are shared in some of these other topic areas. And you can find information on those webinars and how to register under the webinars page of the Community Action Partnership website. So please check it out. A little bit more about some of the framework components of the learning community, kind of how we arrived at some of these focus areas, and kind of the things that we use to fit together on the back end to make sure that these different topic areas all talk to each other, because they're all important as they relate to your work as community action agencies in your different states and communities. And you'll see from some of the components that we have here on the screen, data collection, how you use your data and how it informs the services that you provide and the work that you do is a really critical part, not just because we have to report on it as a part of our national performance indicators, but also it helps you to know what you're doing and why, and how you analyze your data, how you collect and report it plays a big part in that. And a little bit further definition of a learning community and what we're hoping to cultivate with you all through these webinars is really to provide you all with a space and a structure for people to align around a shared goal. And effective communities are both aspirational and practical. They connect people, organizations, and systems that are eager to learn and work across boundaries, all while holding members accountable to a common agenda, metrics, and outcomes. These communities enable participants to share results and learn from each other, thereby improving their ability to achieve rapid yet significant progress. Again, we really think that this quote provided by the Harvard Center on the Developing Child really just encapsulates so well the culture of learning, of sharing, and growing together that we're hoping to cultivate here in the learning community through our various groups. And again, a simpler way of saying that, what we want to help you all do is have a lot of small actions being done by a lot of people, and that will result in a massive change in communities across the country. And a little bit more about some of our demographics. Across our learning community groups, we're excited to say that all 11 regions are participating in the learning community this year, and you all have your footprint in a total of 407 counties across this United States. And that is representative of a great mix of rural, urban, suburban community action agencies. They're culturally diverse. And of course, we have field experts that are doing some really exciting, powerful things in their communities in these various topic areas that we focus on and others. And again, talking about the impact that this can have, just from these groups alone, in those 407 counties, the total amount of individuals that we have the potential to reach through this work is over 1,600,000 people. That is a huge amount of people, and this is the impact that we can have through this work together in the learning community. Of course, I would be remiss if I didn't introduce some of the other members of our team who all work behind the scenes in different capacities to help make sure that you are connected with the resources, information, and group facilitation that you need to take part in this great community that we help to facilitate. Of course, we have Tiffany Marley, who is the project director. Then we have Jarl Crocker, who is the director of our Training and Technical Assistance Department. We are very excited for this other staff member I'm about to introduce, or Jeannie Chaffin. She's actually a consultant with us as a part of our Community Action Economic Mobility Initiative, really working with us on our whole family approach learning community groups and offerings. So we're very excited to have her join us this year. Of course, we also have Courtney Kohler, who is our Senior Associate for Training and Technical Assistance. Liza Porras, who's with me here today, helping behind the scenes. She's our Program Associate for the Training and Technical Assistance Department. And last but certainly not least, we have Charity Frankowski. She is actually a AmeriCorps Vista volunteer working primarily on our Rural Impact Project. And again, I'm Hyacinth McKinley, the Program Associate on the Learning Communities Resource Center. So without further ado, I'm going to turn things over into the more than capable hands of our presenters today, Dr. Barbara Mooney, who really needs no introduction. You all know her and love her, but she is our subject matter expert for this Cultivating Data-Centric Organizations group. So with that, I'm going to turn things over to Barbara, and whenever you're ready, you can get started.
Thank you, Zandy, and we are going to be talking today about data that might be siloed, and how we can address that. We're talking about data-centered organizations in this learning community, and so we want to see how the services that are delivered in silos can prevent that data-centric thinking. And Zandy is going to work the slides for me, so you'll hear me say next slide. Hope that'll get us moving forward. And you can certainly enter questions or into the chat or into the Q&A, and Zandy will be helping me look for those. This is what you see on the screen. The webinar objectives is what we talked about for this session. That we're not only talking about data-centric, but also about this concept of data holistic. You know, thinking about data across the whole agency, a kind of a whole agency approach to data. And we think part of this is to consider what outcomes that you have for populations, and that is across services, and how the different data elements that you collect support the outcomes, and how program outcomes really come together to create this whole agency or agency-wide outcomes. So those are the kinds of things we're going to talk about today. So next slide, Andy. So just a quick review next of what we talked about last time, just so those folks that may not have been on the call the last time get caught up. We talked about core values, and that agencies that would consider themselves data-centric might have. And so there's kind of a checklist of what are some key characteristics. And the first one is that the data-centric approach values decisions that are based on data, so data-driven decision-making. And we have to have data that is accurate, reliable, timely, and complete. And so anytime we're talking about data, we're talking about data quality, and that data has these four, it has quality on these four levels. That we recognize that a data-centric organization isn't just about data elements. It's not just about software collecting data, but it's really about a management system that that understands, monitors, supports, values data entry, and provides some follow-up for the staff and for the processes that are involved with the system, and that the agency has a system to store, retrieve, aggregate the data so that it can be analyzed. So those are some key points. And some things that we talked about last time that we're not going to talk about today, but that are embedded in the things that we will talk about, is the management of data collection, analysis, and follow-up, decision-making based on data, and the fact that we must have data-based communications and that we must have systems of communication. So we talked about these different areas of data storing and collection and analysis and putting into action. And we asked the question, what areas what of these areas could we use some new skills for our staff? What could be developed? And so we'll talk more about that, but I just want to remind you that that's always something that you need to be thinking about when we're talking about any changes. What skills will be needed to implement those changes. And we talked about this last time, and it really becomes important in our discussion today that the organizational culture of your agency has to support, foster, and maintain this idea of embracing data. If the organizational culture is not supportive, then anything that you try to put into place will not be successful. So next. We talked about aggregating and integrating. We just introduced this topic where you aggregate similar data elements together. So it could be how many people of a certain age were served, or how many people in a zip code, or some other similarities that you've grouped people together. But today we're going to talk about integration. And integration is a little different, is very different actually from aggregating data. Aggregating is just, it's bringing it together, but integrating it is including different kinds of data elements together. And it's talking about how many people achieved it, who had this service, and also achieved an outcome. So connecting different kinds of data into a system to integrate it. Next. And we're going to talk about what we mean by integration some more today. So since this topic for today was about moving data out of silos, I thought it would be important for us to really think about why we need to do that. I mean, why is it important? Why is there so much emphasis now on this concept of moving things out of silos? And these were the couple of things that I came up with that have been the result of other learning communities and some of our other work, listening groups, that there is an understanding that if we are unable to connect the services that we provide with the outcomes that are achieved by the individuals, families, and communities with whom we work, that we're not showing the full picture. We might say this is what we do, but it doesn't say so what. Or if we say these are the outcomes that we achieve, but we don't show the kinds of services that went into those outcomes, we may not be showing the complexity of the issues that we're addressing. So we need to look at that interconnection. And we realize that problems aren't in discrete packages. So someone that has a housing issue or a problem with housing may have problems in other domain areas. So often the presenting problem that a customer brings to a local agency is only one piece of the big problem. And that if we want to move people towards long-term change, we have to acknowledge the complexity of this interaction and the fact that these are not just discrete issues, that we can't just solve this simple single problem that we're presented with, but that we have to look at many different kinds of services. So that's the why, I think. That's behind the why. So next. Just a simple graphic that you've probably seen before, where we're saying that sometimes one service produces one outcome, and sometimes one service produces many different outcomes. And other times you need multiple services in order to achieve a single outcome. And more often what we know is true is that multiple services produce multiple outcomes, and it depends on the other resources that families and communities have to know how effective any one of those services or what set of services are going to be most effective. Next. Again, this is a statement by the Annie Casey Foundation that says, well, how do we get there? How do we get to integrated services? Let's say we know that we want to move out of silos. Well, what does it take? So this is I think this is a really foundational statement that integrated services required first and foremost a well-planned program design. You have to understand what the program is going to look like when you move forward. And then you have to have staff that are able to deliver the programs. And then you have to have a thoughtful use of technology and data collection. So both technology and data collection come into play for our discussion about the data-centric organizations. So this is an old graphic. It's from a California agency, and I think you might have to click it a couple of times before it comes in. So whoops. So on the left side of the screen is services, basic services, and more services. That's our plan. We're going to deliver services. Whatever services are needed, we are going to deliver them. As opposed to having a strategic process where we have basic services, we have advocacy, we have a series of pillars, and I just we're here were a few things: jobs, education, training, healthcare, those kinds of services that are skill building and resource building. And then those support asset accumulation, improved living, improved quality of life, and self-sufficiency. So the idea that if you can bring together a lot of different kinds of services, then you can move people to self-sufficiency as opposed to services and services. Okay, next. So this is the next two slides. This one and the next one shows two different approaches. Zandy talked about Jeannie Chafin, and this is some of her work where you have programs that are siloed. They each have their outcomes that are measured by a certain number of indicators, as opposed to the next slide, which is an integrated integration model where the agency has some strategic outcomes that it wants to achieve, and the programs feed into different strategies and indicators which are all unified in one way. So there are just some different ways of starting to think about this whole agency approach that is part of the data-centric organization. So how do we move there? I think the first thing that you want to talk about, or you want to think about, is why you would want to change your approach. If what you're doing now is working for you, then why would you want to change it? You wouldn't. So you have to start to think of what's the purpose of moving to this new approach, this integrated approach. Is there a different need? Are you seeing services that are not producing the kinds of results that you want? I mean, they're working, but they may not be producing what you want them to produce. So because if they're working fine, then why do you want to change them? You wouldn't be motivated to change them. So so you need to really start thinking about this difference between the program outcomes and the agency-wide outcomes, and how one of those moves people towards self-sufficiency, and one is really about services and more services. One of the questions that you'll have to think about before you really move forward is, are there funding sources that are not helping you move towards these national goals of economic security and vibrant, healthy communities and participation of your customers? They're designed to produce a certain outcome, and they're valid for that, but they are not designed for the movement out of poverty that community action would like to see. So let's say that you've answered these questions and you say, I would like to change my approach, because I do see where if we joined forces in our own agency, if we pull things together more, we could see some more progress. So now we're going to think about questions related to this new integrated approach. The first thing really is to think about the programs that you offer and figure out which ones you could add services to or integrate in a way that would become more packaged. where would that financial capacity come from? You know, how would you fund it if you wanted to change it? What other resources are there to support this change? I mean, would partners help you? Would funders help you? Would local community groups help you? And then that same question that I asked before, what skills are needed? What skills do you already have? And also, what skills are needed to move you in this direction of integration? And just to clarify what we mean by integrated services, of course, I think this one is obvious, but maybe not. But we're talking about more than one service. It's not just, you know, we need, if we're going to integrate services, there needs to be more than one. And that the way that we integrate them needs to be planned, coordinated, sequenced, as well as integrated. And we may identify a certain designated set of services that we want to start with as our integration project. That we establish a time frame with multiple check-ins along the way, that the agency staff knows that we're going to be checking in to look at how this integrated plan is working. And that we need somebody that's going to shepherd this forward. In our call last time, we talked about how the community, the community action agency that we mentioned, brought things together, integrated things. And one of the key pieces was a designated staff person who can really help to bring this together. And that's true at the management level, and it's also on the direct service level, because you need to have a staff person who helps the customer go from service to service. And that there be clearly defined outcomes. What do we want to see happen that might be different? Another question is, what mix of services do we want to integrate? I know in some of the studies that have been done about two-generational work and whole family work, that we're talking about a specific set of services. So maybe some tangible assistance, some education, some resource building, some support services, but it's up to your agency to think about what services will you bring together into this integration piece. How long are the services? What's the length of the services? What's the frequency? And how do you pull those together if something's a short term and something's long term? How do you put them together in a time frame that makes sense? Remembering always that that we don't do cookie cutter programs with our families and communities, that we depend on a good assessment of what's needed, and then we could respond to the needs with a mix of services that would be unique to those individuals. So how do we move out of silos? Well, that's really part of the question. In terms of the data, we have to identify which programs would be integrated. In some cases, there are going to be programs that you can't integrate, and you need to know that and what your restrictions are. But I think this next bullet is a key, that you're developing a common intake, at least for the set of services that are being bundled or integrated. I know that whole agency data systems really rely on an agency-wide common intake. That's one of the first principles of how do you integrate services? Well, you don't start after you've already got a lot of data and then try to bring it together. You start when someone's new to the agency, and you do a common intake that then becomes the basis for the data systems that you want to integrate. And then you have to see what is it that you want to know. What data will you integrate? I mean, it's not about just integrating every piece of data that happens, but you need to know which demographics or characteristics or challenges do you want to specifically identify that you will be addressing in terms of your data system. And all of the needs of the target population should be part of that assessment. That common intake should be the first step on an assessment process that can be used for all programs, so that you're not asking housing questions in the housing department and education questions in the education department, but that you have a comprehensive assessment tool, and that will form the basis of your service delivery and also your data collection system. And then train staff. I can't say enough times how important it is to have staff that understand the process and have the skills for the process, and also that they are provided sufficient time to do the work. But finally, that they have appropriate supervision, that there's follow-up of the staff work, as well as the last bullet there that says follow-up of the services that are being provided both inside and outside the agency to know what's happening to our customers. So follow up with staff to support their data entry so that you can collect and integrate it, and follow up with the customer so you know what happened. So tracking the integrated services and looking at breaking down silos really does start with that plan. And the plan has to identify how we're going to do data collection, how we are going to make sure that the appropriate data is collected and entered into a common place, and that we can analyze and learn from the data to make what changes are appropriate. So it has to be part of the plan that that allows for the data to be collected in a way that will then integrate that data. And we need to know sort of this unduplicated count of clients, but that helps us to know which clients got what services, where they got them, how their services were delivered, how often they got them, how long they got the services, and then, and finally, next, how the policies and the procedures of the agency have to change. So when we're talking about breaking down silos, we're talking about policies and practices that are part of the agency, the organizational culture that supports this results orientation. There has to be clear direction and clear practices that are part of your plan. It has to come from agency leadership. This can't be something that's a grassroots effort. It has to come from the leadership, and the leadership has to support the effort to move to this comprehensive strengths-based approach, and has to really be constantly communicating this this process forward. And there have to be resources. This is not something that you can just throw together. You have to have resources because there are going to be changes made, and you need to be able to support the additional time that it might take up front to get things organized, and then also to deliver the new system and to collect the data. And you have to acknowledge that. You have to understand that this is not going to happen overnight. That moving away from silos is going to take a lot of work, but it's also going to take a lot of time to do it. So what has worked in this process before? It it works when plans are set out ahead of time so that we know what's observed and documented and reported, and we know that these things are all established at the beginning of a new approach, and that you come to analysis after you've done your tracking and you understand what's happened, and that you can distinguish your outcomes that are from this new approach from outcomes that you've achieved in the past. So let's say you do this integration project and you find out that that people are getting much better outcomes in these areas than they did in the past. This is the way that this data is going to be useful to you. And if you find out they're not getting better outcomes, then that's the point at which you need to say, well, what's happening here and why? What are the barriers? So what's different about this that would cause problems? So the last two slides that I have to share with you today are about some things to consider. A lot of times we say that whatever the worker's competence is, that's what limits or produces outcomes in a new approach. But in addition to that, we have to have agency policies, we have to have organizational culture, we have to have good job descriptions and an understanding of the workload of the people. We have to have linkages with community and resources, linkages with resources. We have to have buy-in from the entire agency, and it doesn't hurt to have buy-in from the community as well. We have to have time to do this new approach. We have to have training. And then we have to have participants that want to do this integrated approach. I mean, one of the barriers that I hear all the time is that the customers really don't want more than one service. They come in, they just get the service that they want, and they go. They don't want more. So one of the things to consider if you're going to try to move out of silos is, do you have participants that want to do this work? And just this is repetitious of what we've said before, almost a kind of a summary. We need well-trained staff, a single intake process. We need to expand or differentiate the services that we're doing. We need to be able to understand funding. How do we blend or braid funding from these various services? We have to have policies and procedures related to documentation so that we know where the data is coming from. And then we have to have data systems that really work, that we can get reports of an unduplicated count, and we need to have documents, the ability to document agency-wide impacts as well as just program outcomes. And then we need to understand how individual agencies who want to do this kind of silo busting are going to fit into a state-level framework that could support this process. So that's the overview that I've prepared for you today. So I'm hoping that some folks have put in some chats or some questions that Zandy has that we can talk about, or if not, I'd invite some folks now to come forward.
Thank you, Barbara. We haven't gotten any questions yet, but this is a perfect segue. We do have some time to hold here for any questions about some of the processes and different approaches that Barbara has just shared with us relating to getting out of silos. So we'll give you a few moments to enter those in through the chat box, and then we can have a little discussion. So go ahead and start entering those in, and please be sure to select all panelists from the drop-down menu before you send. That way we can all see your question and make sure that one of us answers it or addresses it. So.
And one of the specific things I would ask of participants is, was this helpful? Did this, and you'll have a chance to do this as well in follow-up. I know Zandy will be sending follow-up out, but But if there's something that you were burning to know about today that we didn't touch on, let us know about that. And you know, I'm a firm believer that you need to think about what this all might mean to you when we're talking about changing from a siloed approach to an integrated approach. So we can only guess what you need to know unless you tell us.
Exactly right. So please feel free to send them in now, and if at any point, like say right after we close the webinar, and you're like, oh shoot, I actually have a question, please feel free to reach out to any of us. Our contact information will be provided later on in the presentation, but feel free to shoot any member of the LCRC team just an email with your question and let us know that it relates to today's webinar, and we'd be more than happy to answer your question or connect you with Barbara so that you can get a response. But we do have one that just came in through the chat. Is there a step-by-step process or best practices from a CAA that has successfully worked through this integration approach?
And I would say that that's where I got a lot of the bullets that I presented today, the idea that you have to start with a plan. You have to know which services that you already have that might work together to form a new approach. And so those items were all from former agencies that have done that work. And I did see Tiffany Kymag ask about, is this similar to a bundled service approach? And yes, the idea of integrating or bundling services or having what's now being called a whole family approach, we're really talking about the same kind of thing where you're looking across services to find outcomes, more meaningful outcomes.
And Barbara, before we go on to another question, I would like to direct folks on the line with us to another resource that kind of highlights some of those best practices. As you talked about bundling services and kind of how this fits in with service integration, you can actually visit our case study document that we produced last year that highlights some best practices from 3 different CAAs that participated in our bundling services to improve outcomes, a learning community group through our last cohort. You can find that publication on our website, and we'll be sure to include that in the follow-up email. But it walks through 3 agencies who are exactly in that place, thinking about how to bundle their services and how they would need to think about data collection in a way to do that that would be impactful and effective. So definitely check that out. Let's see, some other questions that have come in. What other insights do you have for agencies who are trying to figure out what to do first or how to get started in this process? Are there any additional resources that haven't been discussed that you would recommend?
So I think the resources you just mentioned, and I would say the first thing, and it also addresses one other question that I saw, how do you get buy-in from the direct service staff? I think the first is a discussion about the outcomes that they're seeing and how the families that they work with, the individuals and families they work with, might achieve greater outcomes if they had additional support. What else might people need? And I think that's the first part of the discussion, because as I said, if what you're doing now works, why would you want to change it? You know, so you have to have some real motivation for change to change your service delivery practices.
Right. And another resource that we've also produced that I want to point everyone's attention to is our Uplifting the Family, a 2-generation approach publication that we did also last year, which highlights CAP Tulsa, and they were doing some really interesting things thinking about this work. So we'll definitely include that in our follow-up communications as well. But thanks for that answer, Barbara. So some other questions that have come in: how do we resolve the issue of funding sources mandating the use of specific data systems which don't always lend themselves to integration?
Well, first you get a magic wand. No. I think that's one of those tough situations that I don't think that there's a super funding source out there that's going to come down and say, you have to all now use this one funding, this one data system. But I think that as the technology, in general moves forward, the idea of cloud computing and about being able to dump data into a common database becomes more feasible. And I guess that's one of the reasons why I say think about which services you have the best opportunity to put together in a way that you can get integrated data from it. So other than having someone say that individual funding sources can no longer mandate their own data systems, we're going to have to determine ways to work around them.
Great. Thank you for that, Barbara.
It wasn't a good answer. It was an honest
but
answer.
It's an answer. It's an answer. Sometimes that's all you have. So thank you. Another question that has come in that's kind of related, any ideas on helping agencies come up with a universal intake process when they have a lot of different program requirements or grant requirements for the different services that they're providing?
The agency that I worked in southwestern Pennsylvania, I worked in for many years while I was there, and now this is more than 15, I hate to say more than 15 years ago, but we sat down and we did just this. We said, we have so many different programs, and we're going in so many different directions with families that we know are the same families. We need to have an agency-wide intake system. And it took a long time to figure out what questions would be asked at that level, at the agency level, because then the individual programs wanted more specific information. If you have an agency intake that has the basic information that can be shared, it's less time consuming to do follow-up interviews at the local level that have some specific data elements. So I would say to get a set of data elements that are most common amongst all of your programs and use those as the core, and then start to build on that to determine what would go into an agency intake process. And then really it goes to one of the other questions, how do you get buy-in? A frontline staff person is sitting at their desk doing their job with their customers, getting the outcomes that they're funded to do. Why would they want to do anything different? How do you say, well, we need you to enter data into an agency-wide system? And until you can prove that there's value to that person in the data collection, you'll get uneven data entry, and it will need to be supervised, and the value of them putting that data in has to become apparent. One of the values could be that it's part of your job, and if you don't do it, you won't have a job. I mean, in some cases, it comes to that it has to be a job description element that they would integrate, that they would put data into a larger system, and that they would participate in agency-wide assessment and intake processes. But it takes a lot of discussion with your staff to know what will motivate them to go forward.
Great, thank you for that. That was a great answer. And another related question that's come in, it's kind of a question and a comment, but thinking more about that buy-in specifically, but one of our attendees today talked about that they're having issues with staff not wanting other people to touch their data for their program. Do you have any suggestions on helping staff to see that their data does not just belong to them alone?
This is a question. I thought this had been resolved, that who owns the data? Whose data is it? I recently was part of a discussion where software vendors tried to say that the data was theirs, that they owned the data. Of course, we know that can't be true, that the data actually is the participant's data. The data belongs to the customer, And in some cases, the frontline staff can be made aware of the importance of sharing their data, because you can do an awareness campaign with the participants and have the customers say, you could get more than one service, and that service would be easily accessible to you by sharing the information from your program. So to getting customers to say they want their data to be shared is one way to overcome the idea that staff becomes possessive of the data, because it isn't the staff's data either. It really is the customer's data.
Exactly. I was going to say that's exactly right. I was going to say our perspective on that, from what we've learned through facilitating these groups and learning more about the ins and outs of how this works, is whenever that question kind of comes up, it doesn't belong to any of us. It's actually the customer's data. So it's thinking about it and treating it in a way that's going to bring about the best outcomes for your clients is how you should be thinking about that. So that was a great question. A couple of others that have come in. I want to be mindful of everyone's time for our webinar. Let's see.
I'll just the one about health outcomes.
Yeah.
You know, if you look at outcomes, you look at community level work, you look at individual and family well-being programs. A lot of work is being done in the health arena. And why is that? That's because I think, I could be definitely wrong, but I think that the reason is that that healthcare costs a lot of money, that it's very expensive, and so and there is a lot of there's a lot of money and a lot of resources in health areas, and so people are saying, well, how can we reduce the cost of healthcare? And what it comes to is that healthcare is so, health determinants or individual elements of health and well-being are so interwoven with economic status and with lifestyles, and they're interwoven with so many things that we normally work with in the community action field, that there's an opportunity for linkages between community action agencies and healthcare providers and health resources that we should take advantage of, that we need to be looking at and thinking about how, if someone is not healthy, if they have poor health, or if they have poor eyes, or if they have poor teeth, you know, their dental coverage is bad, it's going to affect their ability to participate in school, in work, in the economy in any way. And so we really need to consider how those things are intertwined. And there's a lot of data out there in the healthcare field that could provide us with a lot of information. So it's important.
Right, and I will also, again, say a shameless plug for some other things that we're doing on our project, but if you're interested in these kinds of approaches, thinking about data and how it ties into the work that you do as it specifically relates to health outcomes and social determinants of health, we actually do have an open learning community group that's called Health Intersections that talks about exactly that, how you collect, analyze, and use the data that's available to you as it relates to health outcomes for your clients. And you can find information for that webinar series on the Community Action Partnership website under the webinars page. But definitely check that out if that's something that you're specifically interested in. And I know another one of our attendees specifically raised a question about this question in relation to how to collect and analyze data on a whole family level. And I will say that both our integrated services group and our whole family approaches group actually offer these, what we call knowledge building webinar presentations that everyone in the network that is interested in learning more about that topic, they can attend those events. Again, you can find that information on our webinars page, but I would want to direct you to those and very much encourage you to attend and join us. We'll be diving more deeply into exactly those types of questions. So do keep that in mind. So I don't see any other content-related questions, but one quick thing I wanted to do before we kind of move into our closing and let you know about some other upcoming events that we have is just to pose a question and to get you all a little bit more involved in the chat. But thinking about some of the questions that have come in and wanting to make sure that we are providing you with content that's relevant and impactful as we continue to learn together in these presentations. I would like to ask you all to just use the chat window really quickly to answer the following question. How does the data configuration currently look in your organization? How siloed would you say that your data collection is right now in your agency on a scale of 1 to 5, with 1 being very siloed and 5 being fully integrated? So I'll share that in the chat, but if you guys could just take a few moments to enter that in, that would be really great. Getting some 3s, 4s, a few more 3s, some 1s. Thank you all for sharing. Getting some more. Someone said very siloed, so I guess that's a 1. Great. Thank you all for sharing, and please feel free to continue to do so as we're going through. We actually can save everything that we get in the chat box so we can follow up with you later to connect you with some additional resources related to what you're struggling with or what you want to learn more about. But I'd also like to ask you, in relation to that, can you tell us just really briefly what you feel like is your biggest need at this time as it relates to de-siloing your data or data integration? If you could share that in through the chat window, that would be really great. So again, what is your biggest need? So what is your biggest need relating to de-siloing your data? So if you could just share that, we will, like I said, we'll hold on to these chats, and we'll use that to make sure that we provide you with information that addresses a lot of these concerns. So training staff technically, getting them technically savvy in the different systems they need to use, the ability of commercially available databases to speak with one another, cultural change, permission to share information, and integrating different data systems. Time, yes, that's always a perennial challenge. There's never enough time to do all the things that we need to do. Again, compiling data from different databases and systems. Software challenges, it's not quite nimble enough to manipulate the data as they need to. Staff training, needing buy-in from upper management, helping to facilitate cultural change. Great. These are all very helpful. Thank you all so much. We'll keep track of those, and please feel free to keep sending them in as we go through. But I think with that, I think we'll go ahead and wrap up. I want to say thank you so much again to Dr. Barbara Mooney for walking us through today's conversation and getting us started on what I think is a really impactful and energetic train of thought for our network at the time. So thank you so much, Barbara. Appreciate your time.
I would just like to close with saying that the support from leadership is key in this. I saw some chats about they have to have CEO buy-in and so on. And we're hearing that across the network, that's really what we need to focus on, is making sure that leadership is behind this movement and is buying into it. So those are my final comments for today. Sandy, thank you.
No problem. Thank you so much, Barbara. We'll see you next time. All right, so thank you all so much, and I just want to close with some upcoming webinar presentations. As I mentioned, we have some that relate to exactly some of the questions and concerns that you're continuing to share with us in the chat. So please stay tuned for just a few minutes. I'll let you know how to get connected to those resources. But in particular, I want to definitely recommend our Learning Communities Resource Center blog. Here's where you can find all the resources and also publications that have been produced over the last 2 cycles of this work. We're entering into our 5th year facilitating this work, so there's just a wealth of data on exactly these types of topics and how they intersect with some of the other service areas that I'm sure you all are working in, so please go check it out. You can find all of that on the resources page, but I definitely recommend that you subscribe to our blog, and when you do so, you'll get an email alert anytime we upload any new resources or we share any new posts on the blog, so definitely go and check that out. And of course, we also want to recommend the CSBG TTA Resource Center. This is kind of like the Mac Daddy of where all of the resources that are shared and developed across our training and technical assistance work is stored. It's a great resource for you all as you're thinking about this work. As Barbara mentioned, de-siloing your data is not something that you're going to be able to do overnight. It really requires a lot of thought and preparation as you think about how your different systems and programs work together and what approach is going to be best to help your data talk to each other a little bit better. So definitely want to recommend this database. In addition to resources, this website also features a consultant bank where you can specifically look up some consultants who might have expertise in this work, and also a TTA submission function where you can send in direct questions, and we will respond to you as soon as we can. So, as you all are joining us here today, hopefully you already know, but if not, you just participated in a Webinar Wednesday presentation. If you're looking for information on innovative anti-poverty approaches, you can find them here on Wednesdays at 2 p.m. Eastern Time. You can join us. You can use the link that's shared here on the screen to check out our full webinar calendar that we have, I believe, through about September of this year. And also, again, on the webinars page of the partnership website, and also on the Learning Communities Resource Center blog on our upcoming events page, you can find all of our registration information and learn more about our other open learning community groups, and also some of those open webinar events that we will be facilitating as a part of our closed or intensive learning community offering. So please check that out, and hopefully we'll see you back with us on Wednesday. But related to what we discussed today, another webinar presentation that we are very excited about and we wanted to connect you all to is coming up on May 2nd, and that is entitled Building Intergenerational Success, Measuring Whole Family Outcomes. We are really excited to go through this presentation and kind of talk you through the 2-generation playbook that was developed by Ascend. So if you're interested in learning more about a whole family approach and how you can use your data to kind of inform that work, definitely make sure that you register and attend this event. In addition to our different websites, we also have a feature that we are really excited to provide to you all through this cycle of the learning community, which is our Community Action Academy. It's on the Moodle platform, but this is basically your one-stop shop for everything that relates to the learning community, anti-poverty practices that we focus on here on this project. It's totally free to set up an account. You just need to enter in your email and username, and you can have access to all of the open information, the webinar events, even some little courses and quizzes that relate to these topic areas. You can find that here through Community Action Academy. So definitely go check that out, register today. And if you continue to have issues with that, you can reach out to any of the LCRC staff, although I will highlight Courtney Kohler. She is kind of our main woman in charge of Community Action Academy and really knows the ins and outs of it, so she'll be able to help get you sorted and make some great recommendations for you. So please sign up today. And of course, here is the contact information for everyone on the LCRC team. Please feel free to reach out to any of us with any of your questions, comments, concerns, thoughts. We'll do our best to help you get sorted out. And we do want to connect with you and learn more about you, so please feel free to reach out at any time. So with that, that's actually going to conclude today's webinar presentation. Thank you all so much for joining us. It was great to connect and learn with you today, and we hope to see you next time. So thank you. Enjoy the rest of your day.